Hey guys, welcome back to UWorld's Next Gen NCLEX review. My name is Nicole here with another question drill set. If you are new here and don't know how a question drill set works, well, welcome in, glad to have you. We have a lot of new followers and subscribers to our channel, 100,000 to be specific on Facebook, which is always good to see and to hear. But how a question drill set works is I pull up a question here to my side and I give you about 30 seconds to read over it. Read over the answer choices very carefully, and then I'll tell you why the right answers are right and the wrong answers are wrong. And then we get into the nitty-gritty of how we get to those right answers and maybe some keywords in the questions that kind of hone us towards the right answers. Today's topic is ECG. We got a lot of requests to do ECG practice. So rhythm strips and recognizing the correct rhythms, as well as some interventions depending on what those rhythms are. So let's get started. In our chat today, also be chatty in the chat. In our chat today, we have Nurse Samantha moderating for us. So if I go a little bit too fast or you need reiteration about what a rhythm or intervention is, chat with her in the chat. And then I also just like to talk to you guys in the chat and create a little community. So don't be shy. I have it pulled up and I'm happy to see you guys as well. Let's get started. Question number 1. The nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing what? Is it option 1, atrial fibrillation? Option 2, ventricular fibrillation? Option 3, ventricular tachycardia? Or option 4, sinus bradycardia? Let me know what you guys think in the chat that this rhythm is. So we have a lot of questions like this where it's just trying to figure out what the rhythm is, kind of knowledge and understanding. So let me know what you guys think in the chat. Hello everyone. Someone says, can I get this live recorded video? All of our videos are posted after the live has ended on all our social medias. The easiest way to find these things that I believe is on YouTube, so you can search directly the topic that you want. So in this case, you would search ECG and you can find the video posted afterwards. Lots of good answers in the chat. This one seems pretty unanimous. Keep going and dropping your correct answers in the chat. And then I'll give you guys some hints on how to kind of recognize these rhythm strips. What I go through, my little step process. Good job, guys. Good job. Be sure to follow and like and subscribe to all of our social media platforms, Instagram, TikTok, YouTube, Facebook. Like I said, we got 100,000 followers on Facebook. So let's get us up on those subscribers on any of the other channels. I see a lot of people on TikTok and Instagram today. So share with all your nursing school friends and students as well. So the correct answer for this one is option 1. So many of you guys got this right in the chat. It is atrial fibrillation. The one way that I use to kind of break down the rhythms, it's kind of a step-by-step process, like I said, starts with, do I see P waves? And in this case, I don't see a definite P wave. There's a lot of different squiggles that could be a P wave, but I don't know which one it is. The next part of the step would be, do I see a QRS wave? Which I do. And then, do I see a good PR interval? Well, since I don't see a P wave, that means it's more likely an atrial type of rhythm, since the P waves have to do with atrial contraction. So I'm leaning toward an atrial type of rhythm, especially since I can't measure a PR interval. With atrial fibrillation, I'll point to this picture. We see a lot of quivering with that P wave, with a lot of the fibrillating waves where the P wave should be, which means that we can't get a definite P wave, we can't get a PR interval, that atrium is quivering. And then the QRS interval between each other, the R to R, these are irregularly irregular. So even if you try to match them out, they don't match up because of all those fibrillating waves in between them. So this option, or this answer to this question, is atrial fibrillation, because everything is irregular about the rhythm. You guys did good. Question number 2, the nurse is caring for a client who is short of breath and is experiencing the cardiac rhythm in the ECG strip shown below. Which of the following actions should the nurse take? So I will also say this is all of our strips are 10-second strips, meaning that our strips are a lot longer. So when you're trying to count a rate, be very, very careful. With 10-second strips, you multiply everything by 6 to get the rate, since there's 6 10-second strips in 1 minute. So use that to your liking. Cough, cough. With this, option 1, administer an IV fluid bolus. Option 2, prepare the client for synchronized cardioversion. Option 3, instruct the client to bear down. Or option 4, prepare to administer IV push atropine. Which one of these interventions would we do for this strip up above? Let me know what you guys think in the chat. Lots of good rationales. Good job, good job. So it's like, where were you 2 hours ago? I don't know if it was 2 hours ago, but we were live at 11 a.m. 10-second strip. Think y'all are doing just fine with this. Good job, guys. So I asked, what was the answer to the first one? That one was atrial fibrillation. I don't remember what. I think it was option 1. Make sure you're calculating your rate correctly. So, correct answer for this one is option 4, prepare to administer IV push atropine. But again, like I said, let's go back to the rhythm and try to figure out what it is. Do I see P waves? Yes, I do, and they're very prominent. I can only see that 1 P wave in each interval. Do I see QRS waves? Yes, I do. They look regular and right. And the PR interval, for the most part, seems accurate. So I know that this is a sinus type of rhythm, since all of the components with the P and the QRS waves are equal and regular. So now I have to calculate the rate. And since I said this is a 10-second strip, we're going to count the QRS waves, which there are 9 of them, by 6. 9 times 6 is 54, which could be considered a bradycardic rhythm. Less than 60 is bradycardia. More than 100 is a tachycardic rhythm. So this is 54 beats per minute, sinus bradycardia. Since all of our components are there, it's just at a slower rate. So the intervention for sinus bradycardia would be option 4, to prepare to administer IV push atropine. Atropine is a medication that we give to accelerate the heart rate, and it works fairly quickly and very well. And you do it through a push, not through a drip or a continuous type of thing. Options 1, 2, and 3 are all things that we would do for a tachycardic rhythm, so a rhythm that is greater than 100 beats per minute. So this one, administer IV fluid bolus, that kind of increases the vascular blood, and so the heart doesn't have to work as hard to pump at a faster rate. Option 2, prepare for synchronized cardioversion. Again, something to slow the heart rate down based off of what rate that we want. And then option 3, instruct the client to bear down. This is that vagal maneuver that pushes down on that vagal nerve to slow down the heart rate. Those are all things to decrease the heart rate, but we want to increase the heart rate in this case, which is atropine. I always think of the T in atropine, and the AT is add and plus, so we're adding to the heart rate. So you guys did pretty good. Next question. The nurse is caring for a client who's experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing what? So again, another knowledge and understanding. What type of rhythm is this? Is this ventricular tachycardia? Is it atrial fibrillation, ventricular fibrillation, or is this sinus bradycardia? Let me know what you guys think in the chat. Good job, guys. I'm wondering, is it too soon to start thinking about school starting back up? I know summer went by really quick. I feel like August is just about to start next month. But before you know it, the semester would have started, and that means a lot of conferences are starting with the nursing conferences, which I'm so excited to hopefully meet you guys at the nursing conferences this upcoming year, or this upcoming semester, specifically the NSNA mid-year in Columbus. So Shout out to all of you guys who were at the annual one in Seattle this past year, or earlier this year in April. Looking forward to seeing a lot of you guys at NSNA mid-year. We're going to SNAP conference. We're going to the California conference. So a lot of opportunities to meet you guys in real life. Please sign up if you're in those local areas or able to go to these conferences, because you get a lot of good information and fun resources like these with lectures and webinars and hands-on skills at these conferences. Good job, guys. Pretty much everyone has been getting this one right. Wait, let me line up the right answer choice. Yes, a lot of people with correct answers and great rationale. I love to see that. Option 1, ventricular tachycardia. This is the correct answer because we have those wide QRS waves. They're wide and bizarre. That's the main indicator for VTach. And then we also don't see any P waves within this. We don't even see anything hidden. So we can't even assume that there's any atrial happening with this type of rhythm. So it's straight up ventricular tachycardia, since we're not even seeing P waves being hidden in anything. But you guys did very good. Very good. Next question. The nurse is caring for a client who's experiencing the cardiac rhythm in the ECG strip shown below. Which of the following medications should the nurse expect to be prescribed for the client? So again, figure out what the rhythm is first. Go through the step-by-step, P waves, QRS waves, regularity. Then try to figure out the intervention needed for that specific rhythm. Are we using epinephrine? Are we using atropine? Are we using rivaroxaban? Or are we using lisinopril with this client? Let me know in the chat. What type of medication would a client with this rhythm usually be prescribed? Pretty good. Good job, guys. Also, let me know in the chat what topics you would like us to see. There was I can't even say my words again. There was a lot of requests to do ECG rhythms and rhythm checks and interventions topics. So that's why we did it this week with the question drill, as well as our question of the day last week. So what other topics would you guys like us to cover in the next couple of weeks? And we'll try to incorporate it as we go. Especially with school about to start. Maybe what classes are you about to take this upcoming semester that you kind of want to get a jump start on? Someone asked, do we cover PN NCLEX? We don't cover them with our lives, but we do have a product that covers PN information. That is on uworldnursing.com. You can switch it over from RN to PN to get that type of help. Good job, guys. Someone said psych, someone said priority and triage, mental health. Someone asked, can you explain the calculation again? So yes, if we're trying to figure out with our strips, here at UWorld, we use 10-second strips. So there are 6 10-second strips in 1 minute if we're trying to calculate the rate per minute, beats per minute. So how many QRS waves that we see, you multiply by 6 with our 10-second strips. Maybe in your school you use a normal 6-second strip, but here we use 10-second strips. So multiply by 6. Pharmacology, peds, and lots of correct answers with rationales, which I love to see it. Someone says, my first time ever hearing rivaroxaban, which is another word for Xarelto, which is also known as an anticoagulant. So let's go back to the beginning first with this rhythm. What is this rhythm? This rhythm, let's start with our first question. Do I see P waves? Not really. It looks like there's a lot of them, and I can't find that definite P wave to do that definite PR interval to see if it's regular or not. So this is an atrial type of rhythm, and since it's not uniform or sawtooth like it would be an atrial flutter, this would be atrial fibrillation again. So we know our clients with atrial fibrillation are predisposed to having blood clots a lot quicker, since that atrium is just quivering. It's not pushing out all the blood that it can. So sometimes blood back pools in that atrium, causing those blood clots. So we need to put them on an anticoagulant to thin the blood out so it's easier to pass through to the ventricle. So rivaroxaban or Xarelto, anticoagulations are used with AFib type patients. Epinephrine, not used for AFib type patients. These are usually used when they're in those lethal rhythms, usually during that CPR time, that deadly time, epi to kind of restart that heart. Not used in this case. Atropine, like I said before, is for bradycardic rhythms to kind of increase that heart rate. And lisinopril is a blood pressure medication, which they might actually be on a blood pressure medication as well, but we specifically know that we also need an anticoagulant with a AFib type of rhythm just because of those blood clots that could be forming. But you guys did pretty good. Next question. The nurse is caring for a client who's experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing what? So again, figure out what the rhythm is using the step-by-step process. Remember that our strips are 10 seconds. Is this atrial fibrillation, sinus bradycardia, ventricular fibrillation, or a normal sinus rhythm? Let me know what you guys think in the chat. Someone said med-surg, GU, cardiac, neuro. So you just want it all. That sounds like a good maybe like fundamentals type of question drill and review session. Good job. And I love that you guys are helping each other out. Good job, good job. Make sure to count the rate correctly. Prioritization. Someone asked for that this morning and I tripped over saying that word as well. I specifically did a prioritization question drill a couple weeks ago. So I feel like the easiest way to go find that again is to go on YouTube and search prioritization in our little search box once you get to the UWorld landing page. And then you'll be able to find that question drill. Good job, guys. Okay. Correct answers, and I'm seeing lots of you guys calculating it right, is option 2, sinus bradycardia. So this actually is the same exact strip as before when I was asking for an intervention, but I wanted to see if you guys could catch and calculate these strips correctly. So sinus bradycardia, going back to how we calculate it with our strips, since our strips are 10 seconds, normally they will tell you, for the most part, they're usually always 6-second strips. And if not, they will tell you like in the corner that this is a 6-second strip or a 10-second strip. So you know how to calculate the right rate. So we do see P waves and they're prominent. I do see QRS waves and they're prominent as well, and they don't look wide and bizarre. The PR interval looks equal and regular with each complex, so all of my elements are correctly there. But let's calculate the rate. Again, there's 9 QRS waves, so we multiply by 6. 9 times 6 is 54. Again, bradycardic. So sinus bradycardia is our rhythm here. Tricked ya, kind of, maybe not really. I know a lot of you guys got this question right, so good job, guys. Next question. The nurse is caring for a client who's experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing what? Option 1, atrial flutter. Option 2, atrial fibrillation. Option 3, premature atrial contractions. Or option 4, premature ventricular contractions. Let me know what you guys think in the chat. Good job, good job. Also, we are way past my halfway through, but where are you guys tuning in from? I love to see how far UWorld reaches in the world, especially in this later afternoon. We got some late night scrollers across the country, or if you're central or down the street in Dallas, Texas, or domestically in the United States, where are you tuning in from? Love to see how far UWorld reaches. We got Kentucky, Dallas, Florida, Tanzania, Cuba, New Jersey, Maryland, Baltimore, Maryland, Nevada, oh, it's going fast, Palm Springs, Georgia, Iowa, Washington State, Cuba, Long Island, Tampa, London, Cali, Chicago, Colorado, Texas, Indianapolis, Toronto, Wisconsin, Zimbabwe, Colorado, Germany, Atlanta, Georgia, Cameroon, Canada, Kenya, Nigeria, Florida, Minnesota. Sorry, Minnesota. Dallas, Belfast, Ghana, Nigeria, Mexico. Lots of Nigerian people in today. I saw like 5 in a row. Abu Dhabi, Ghana. Someone asked, do you count the PVCs in the rate? Actually, you do not count PVCs. Oh, I kind of gave the answer. This is PVCs, premature ventricular contractions. You do not count PVCs in the rate necessarily because it doesn't have the full complex of a P and a QRS wave in it. So you just count the ventricular rate because usually ventricular rate or QRS that has an adequate P wave with it. But yes, with this answer choice or question, the correct answer is premature ventricular contraction. This is when you have variable heart rate, especially that R to R interval is not consistent. You see, I don't know if I'm lining up, but the 2 over there and the 2 maybe behind my head, those are the premature ventricular contractions. They're wide. They don't look like a normal QRS wave that you see like here in the middle. And it doesn't also accompany its own P wave. That P wave kind of gets mixed in with that QRS wave, which is why it's looking so wide and bizarre. So premature ventricular contractions, that hidden P wave, it's looking wider. And then what else can I say about these QRS waves? That's about it. They just look wide and bizarre, but you still have, for the most part, a normal sinus rhythm in between the premature ventricular contractions. When you have multiple and it's a very slowed heart rate, you could be having a junctional rhythm because they also have those wide QRS waves, or you could be going into a heart block, which is even more of a problem. But these are premature ventricular contractions. We still see that sinus rhythm in between, but those P waves are getting hidden in these extra QRS waves. So pretty good job, guys. It is couplets. Someone asked if it was couplets. It is couplets. The nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing what? Let me know what you guys think this rhythm is. Is it ventricular tachycardia, ventricular fibrillation, sinus bradycardia, or atrial fibrillation? Let me know, let me know. You guys are super chatty in the chat today, and I love to see it, but it's going by so fast that I can't answer some of you guys' questions. Good job. Lots of correct answers. Good job. Good job. Someone says, happy to see you, sister. Happy to see you too. Okay, guys, I'm getting lots of VTach versus VFib. Earlier, we did have a VTach rhythm. So is this one looking like the VTach rhythm as well? Okay, I'm going to go to the answer. It's kind of in between option 2 and option, oops, I'm on the chat instead of the slide. There we go. Option 2 and option 1, ventricular tachycardia is when we have those wide, prominent QRS waves. And then fibrillation is when we don't really have anything. It's just a whole bunch of squiggles. This is the ventricles fibrillating, kind of like how that atrial for AFib kind of quivers. This is ventricular fibrillation, where you can't even see the P waves in between them. So everything is irregular. They're probably pulseless. This is where we defib. You defib, VFib for sure. This client is going down and going down quickly. Get the crash cart, save this client's life. VTAC, again, is those wide, prominent QRS waves, individualized, or sometimes there could be multiple, but you can definitely see that they're more sawtooth-like. Sinus bradycardia would have the full complex, so it would have a P wave and a prominent QRS wave, which we're not seeing any of that here. And then atrial fibrillation, you wouldn't have a prominent P wave, but you would still have that QRS wave. So that's why it wouldn't be atrial fibrillation. But you guys did pretty good. Yeah, someone says VTAC looks like tombstone. They do. They look like a pointed tombstone. Sometimes they can have a little bit of a flat top. Cough, cough. So, the nurse is caring for a hemodynamically stable client who is experiencing the cardiac rhythm in the ECG strip shown below. Which of the following actions should the nurse take? Are we doing option 1, prepare to administer amiodarone? Option 2, prepare the client for immediate defibrillation? Option 3, continue to monitor the client? Or option 4, request a prescription for digoxin? So, figure out what the rhythm is, but also read this question very carefully. Cough, cough. This one gives you a little bit of a hint of which way to go. Also, let me know how many questions out of 8 you got today. I feel like ECG is a kind of a tricky type of question, so I wanted to see if maybe we're being a little bit too easy for you guys. You want some more harder questions. Someone earlier said that they would like more heart blocks or junctional rhythms to be incorporated so we can really, really test your knowledge. I feel like a lot of our strips are like the perfect setting in the NCLEX world, which is true. This is what you're going to be tested on. If you get some rhythm strips on your NCLEX, they're going to be beautiful strips like this. But we know in the real life that the strips aren't looking like this. Your patient's moving, it's lopsided a little bit. So the better practice you get at figuring out, do I have that P wave? Do I have the QRS waves? If we have a good foundation of recognizing these strips, then you have a better chance at recognizing these strips in the real world on a real patient, on a real telestrip. So how many questions out of 8 did you guys get today? And then I'm seeing lots of correct answers with correct rationales. I love that for you guys. Someone said blocks are tough. Blocks are very, very tough. There's a couple of mnemonics to help you remember them, though. Read the question carefully. Someone said didn't read the question. Read it very carefully. Someone says I didn't get anything right today, but you're learning. That's all that matters. You're learning something new. Okay. Correct answer is option 1, prepared to administer amiodarone. So like I said, or let's go back to the question, this client is hemodynamically stable. So that is a very, very, very big key factor in the question, because that means we're going to go from least invasive to invasive. But let's figure out what the rhythm is. Like I said before, and kind of said it at the very beginning, VTAC has those saw or sharp QRS waves, or they could be tombstone looking like this one here. So this is a VTAC, ventricular tachycardic rhythm. But in the question, it says that they're hemodynamically stable, meaning that they're awake and they have a pulse. And so if it's VTAC and they have a pulse, we're going from least invasive to most invasive. So administering amiodarone, which is an antiarrhythmic medication that's used to restart the heart and put them back in a normal rhythm. We usually give that loading dose and then that maintenance dose to keep them in that rhythm, because this rhythm can quickly turn it into VFib, or they can stay in this rhythm for a very long time and then become even more compromised. So we want to put them on a maintenance dose to keep them in a normal sinus rhythm. So that would be our most correct answer in this case. Option 2, prepare the client for immediate defibrillation. This would be incorrect because 1, the client is hemodynamically stable, meaning they're awake and they have a pulse, and we do not shock anything that has a pulse. Please don't shock anything that has a pulse. So we defib VFib because that is a pulseless rhythm, and then we shock other pulseless rhythms, but not this hemodynamically stable one. Option 3, continue to monitor the client. Obviously, this is not a normal sinus rhythm or a normal rhythm to be in, so please don't just monitor the client. We need to intervene and do something to save this client's life. And especially since this rhythm can quickly turn into VFib, we need to be doing something. And then option 4, request a prescription for digoxin. That actually is not the correct answer. Digoxin can actually cause this rhythm, especially if they have digoxin toxicity, which is a lot of digoxin built up in their system, maybe because the kidneys aren't excreting it the correct way. Then it builds up and sends them into this rhythm, and then VFib, and then we got a problem because it's shift change and you got to do the crash cart. Problems. We don't want problems. But thank you guys so much for tuning in. I hope you learned something new. Hope you got some tips and tricks with reading these ECG strips. They can be a little bit hard, but I will give you guys some more ECG strips, hopefully in the future, so we can get better practice with this. But until then, I will see you guys next week. Bye, take care.